everybody poops. And paying attention to your bathroom habits can give you some insight to your health. Blood, for example, can be a sign of rectal bleeding. It's a common symptom that can sound the alarm for a number of conditions,
ranging from hemorrhoids, anal fissures, anal fistulas, to more serious conditions like inflammatory bowel disease, colon and rectal cancer, or anal cancer.
Seeing blood during a trip to the bathroom can be a scary sight, but it's important to identify the cause as soon as you notice this symptom.
In a nationwide study, only 65% of patients referred with hemorrhoids were correctly diagnosed.
Despite the fact that the blood appeared the same way, the remaining 35% of patients in that same survey needed treatment for other conditions. Dr. Ozuner says to be on the lookout for changes when using the restroom.
Blood may be seen in the water, which could appear like red or tea-colored. In stool, blood can present as bright red streaks, dark red, or black terry stool.
In some cases, bleeding may not be visible at all.
We call this occult bleeding. This is usually suggested by symptoms like anemia. You have a blood test and we find out that you have a low hemoglobin, and that's indicative that you're bleeding.
If you're of screening age, 45 and older, your colonoscopy can be scheduled at the time of your appointment. But colon polyps aren't the only cause of bleeding.
If the bleeding is caused by hemorrhoids, which are basically swollen veins in the rectum, we can treat them in the office. We can do an office procedure, such as rubber band ligation.
As of January 2025, patients with concerns can make an appointment at Arnot Health's rectal bleeding clinic at the Southport office.
We see patients 15 years and older. It is covered by insurance.
Referrals are recommended, but not required. To make an appointment, call 607-734-2695. For Arnot Health, I'm Lexi Cutmore.